Edutainment Studios and Access Healthcare welcome you to Chronic Constipation, Getting Relief. This module is part 1 of a 3-part series on chronic constipation. This series is intended to help you understand what constipation is, how you become constipated, and what are the symptoms of being constipated. Chronic constipation is infrequent bowel movements or difficult passage of stools that persist for several weeks or longer. Though occasional constipation is very common, some people experience chronic constipation that can interfere with their ability to go about their daily tasks. Chronic constipation may also cause excessive straining to have a bowel movement and other signs and symptoms. Treatment for chronic constipation depends in part on the underlying cause. However, in some cases, a cause is never found. In this course, the objective is to help you know the basic information about chronic constipation, what the symptoms of chronic constipation are. Most people get constipated every once in a while, but if you have constipation all the time or frequent bouts of it, then something could be wrong with the way your digestive system is working. To understand how you can become constipated, it can help to know what happens when things are working the right way. After you eat, food travels through your digestive system. From your mouth, it moves through your esophagus, stomach, small intestine, and colon, or large intestine. Your body uses the nutrients and water from the food, and your colon takes what is left over and turns it into stool. Usually there's plenty of liquid left to keep the stool soft enough so it can keep moving until it reaches your rectum. The stool stays there until you're ready to have a bowel movement. In a healthy colon, as the stool moves through, your colon takes out extra water. Colon muscles tighten up and relax in a gentle, steady rhythm to move stool through your colon to your rectum. If you have constipation, your digestive tract is not working correctly. Your colon takes out too much water, so your stool becomes hard and dry. Your colon's muscles tighten and relax too slowly, so your stool cannot move through it as fast as it normally would. Symptoms of constipation can include having less than 3 bowel movements a week, dry, hard stools, painful bowel movements, having to strain to have a bowel movement, bloating or feeling full in your lower abdomen. If you have had 2 or more of these symptoms for at least 3 months, you can have chronic constipation. Tell your doctor about all the symptoms you are having. Even if you feel embarrassed, it is easy to dismiss these symptoms and hope they will pass. But chronic constipation can affect the quality of your life. If your constipation symptoms get worse, it could be a sign of something more serious like polyps or cancer. If your constipation is not improving or changing the way you live your life, talk to your doctor. Work with your doctor to help figure out what might be causing your constipation. Some common causes of constipation include not having enough fiber in your diet, not drinking enough water or being dehydrated, not being physically active, taking certain medicines or supplements, including medicine to treat pain, high blood pressure, and heartburn, changes to your routine, having IBS or other health conditions that affect how your digestive system works, ignoring urges to have bowel movements, and abusing laxatives. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 3-part series on chronic constipation. Please let us know how we did by completing the survey. If you have any suggestions or questions, please send them to us via the survey. And come back for part 2.